With today's workshop, we are going to work on improving our skills in communicating end-of-life preferences to providers. So this is more aimed towards patients. End-of-life care is defined as care given to people who are near the end of life and have stopped treatment to cure or control their disease. End-of-life care includes physical, emotional, social, and spiritual support for patients and their families. The goal of end-of-life care is to control pain and other symptoms so the patient can be as comfortable as possible. End-of-life care may include palliative care, supportive care, or hospice care, and those are just different types of care patients can receive. Again, this has to do with their preferences. So, end-of-life care is a conversation that may need to be initiated or started by the patient themselves. So some doctors just don't ask patients about end-of-life issues. So if this is something that you're wanting to talk about with your doctor, or you're wanting to make choices about issues, you will need to talk to your doctor so your wishes can be carried out. This open communication can help you and your doctor to make decisions together and then create a plan of care that meets your goals and wishes. If your doctor is not comfortable talking about these end-of-life plans, then you can go to other specialists for help. So it is very important that you as a patient understand your prognosis and that you have a very good understanding of it. And this is important when it comes to making decisions about like the care and treatment, especially during advanced care. And you'll probably want to know things such as like how long you have to live, and this kind of depends on the type of illness you have and how it's affected your body already, and sometimes this is a very hard question for doctors to answer. And it also has to do with other factors that could be influencing the illness that you have. And treatments don't always work the same for everyone because everyone's different. So your doctor can talk to you more about your treatments and options with you and your family, and explain the effects that it may have on your illness and then the quality of your life as well. Knowing the benefits and risks of available treatments can help you to also decide on your goals and care for the last stages of your life. It is also important to decide on your care goals. Your care goals for advanced illness depend on whether quality of life or length of life is more important to you. Your goals may change. Your goals of care may change as your condition changes, or if new treatments become available, and it is important that you tell your doctor what your goals of care are, even if they do not ask. And it's important that both you and your doctor are working towards the same goals. Next, you need to make sure that you're taking part in making decisions. You need to decide if you're wanting to take part in making the decisions, or if you'd rather have someone else make them for you, whether it be your family or your doctor. This is a personal choice, and it's important though that your doctor and your family know what you want. Early communication with your doctors can help you to feel more prepared for end-of-life issues. It's said that many patients who start talking early on with their doctor about end-of-life issues report feeling better prepared. And better communication with your doctors may make it easier to deal with concerns about being older, living alone, relieving symptoms, spiritual well-being, and how your family will cope in the future. So there are ways to improve communication with your doctors. And you need to tell your doctor how you and your family wish to receive information and the type of information you want. Also, you need to ask how you can get information at times when you can't meet face to face. So remembering what your doctor said and even remembering what you want to ask them can be very hard, especially with this type of conversation. So some of the following that may help to aid in the communication of end-of-life care with your provider, and to help you remember what was said, can be to have a family member go with you when you meet with your doctor. Make a list of questions you want to ask the doctor during your visit. get the information in writing, or to record the discussion with a tape recorder, smartphone, or on video. And then you can also ask your doctor or the doctor's office if they offer any of the following, such as a talk with a psychologist about advanced planning and end-of-life issues, or an end-of-life preference interview, which includes a list of questions that can help you explain your wishes about end-of-life. So making end-of-life care decisions early can ease your mind and decrease stress on your family both. There may be a time when you can't tell the healthcare team what you want, and when that happens, you have to decide whether you rather have your doctor and family make the decisions, or if you would rather make the decisions early so your wishes will be known and they can be followed. When the time comes, if not planned far ahead, the end-of-life care decisions must be made by several